yours are killing me. You know, my yours.
Hey team, it's showtime. Hi everybody, thank you for waiting. Technical difficulties, we're learning together. Thank you for joining us for the Pivots, Innovations, and Adaptations to COVID-19. Let's give each other another minute or two to get all logged in, and then we will get the ball rolling. And in the meantime, if you'd like to post in the chat here in Zoom or on Attendify, who you are, what program you run, where you're calling in from. We're going to be using the chat box 2 more times in this session today, so get comfortable with whichever one you want to use in Zoom or Attendify. And we're really happy to have you here. Alrighty then. Hi, everybody. Welcome to the Pivots, Innovations, and Adaptations to COVID-19 session. Thanks for joining us today at the national convening. I hope everybody's been enjoying the day and learning to use Attendify. My name is Rachel Ho. I'm the manager at the Nutrition Incentive Hub, the Technical Assistance and Innovation team at Fair Food Network. I'm calling you live from Detroit, Michigan. And please post in the chat box about where you're coming from, who you are. And yeah, before we get our session started today, we're talking about COVID, we're talking about the pandemic, and gratitude feels insufficient to sort of describe how I feel about all of you being here and learning about and seeing all the work that we have done together and as our organizations in the last year. So even before we get started, just acknowledging the immense struggle and difficulties of this last year related to the pandemic, and just really grateful for all of the work that I get to see programs doing around the country, and really grateful that we can learn a little bit more and celebrate the programs that we're talking about today. I think all of us have known the importance of the work that we do with hunger and food access, and it's about time that the rest of the country and individuals are understanding the essential nature of the work that we do. So just a lot of gratitude for all of you being here. So the speakers you're hearing today, not only are they wonderful nutrition incentive programs, they're also awardees of our Capacity Building and Innovation Fund grant. We had a COVID rapid response grant that went out in May of 2020. And for a background, the Capacity Building grant, it's funded by the GusNIP program, by the USDA NIFA, the National Institutes of Food and Agriculture. So we're very grateful to USDA and NIFA to provide us for funding for the 4 years of our grant to give funding to programs like the programs you see here to increase their capacity in intense times of need. So this grant, it was at the onset of the pandemic in May of last year, my goodness. And we awarded $300,000 to 31 programs across the country. And today, I'm delighted to share the stage, our virtual stage with 3 of these awardees. So the way our session will go today is that each presenter, they'll have 10 minutes to share about their capacity building, their COVID rapid response grant, but also about what their organizations have done in general in response to pivot around COVID-19. And if you have questions or comments for the presenters, please chat them in either the Attendify platform, or you can chat them in the Zoom box in the Zoom chat over here. And we're going to wait until the end of the session to answer those questions. And we're starting a few minutes late, but that is okay. And I am delighted to share our first presenter. And our first presenter is Ian Finch, and a little bit about Ian. He is the Food Access Program Manager at the Community Food and Agriculture Coalition in Missoula, Montana. He manages Montana's Nutrition Incentive Program, which is double SNAP dollars. And he also facilitates a statewide network of project partners in a hub and spoke model. And this helps project partners implement SNAP matching programs in their regions And this is across farm direct and brick and mortar settings. And an interesting thing about Ian, in his free time, he likes to grow edible landscapes, which I did have to look up today. And he loves to do trail running. So without further ado, go ahead, Ian.
Hi, Rachel and everyone else in the session. Thank you so much for being here and for having us today. This is my first Nutrition Incentive Hub annual convening, and so it's just been really awesome to be here and see all of the energy and ideas that everyone has. So I'm just really thankful to be here. And on top of that, I just wanted to say that it's been a super challenging year, and a lot of our markets went through the same challenges as everyone else in the beginning, with just trying to be deemed essential and just to open. And so what I'm going to share with everyone today is kind of how my organization, the Community Food and Agriculture Coalition in Missoula, helped organizations get kind of that foundation that they needed in order to be deemed essential and to be able to actually open. And I can say with certainty that if it had not been for that Nutrition Incentive Hub Capacity Building and Innovation COVID Response Grant, we would have been way behind. We didn't have funding to do the projects that we're talking about. And so that grant really helped our markets not adapt to COVID, but actually open and actually, provide these services for our participants. So thank you so much, Rachel, and everyone at the Nutrition Incentive Hub. Let me share my screen. All right, and here we go. Thanks, Rachel. So as she said, my name is Ian Finch. I'm with the Community Food and Agriculture Coalition in Missoula, Montana, way out in the west. And CFAC is a farmer-focused organization. And for our nutrition incentive program, we really support SNAP users at farmers markets as one of our primary priorities, because that's in at least Montana where we kind of have our best opportunity to connect low-income SNAP users with our producers. And we don't just do that though. As this screen shows, we have 3 different programs that work really interconnectedly. And the reason that I want to share with you kind of how our programs actually operate and our program model is because without these partnerships that I'll talk about, we wouldn't have been able to have the impact that we did with this grant opportunity. So we have 3 different programs. We have a beginning farmer and rancher development program, and we help hundreds of farmers get access to funding and financing and education that they need to be successful. We have a farmland development and conservation program that acts as kind of a policy advocacy approach so that CFAC has a say in how farmland is developed in our region. And then that kind of all feeds into our food access program, which is the SNAP matching program that I'll talk about today, which is where we're really supporting this food system so that it can support the SNAP users that we're trying to help through this program. And I just want to say we did a lot of COVID adaptation strategies. I'll be covering today what we did with the grant funds from Nutrition Incentive Hub, and then talking just a little bit about some survey work that we did to just kind of encapsulate the whole picture that we're working with. So double SNAP dollars in Montana, you can see a little map of the state there. We have 26 sites and they're pretty much spread across Western Montana and then kind of moving out through the state. And Montana is actually a pretty large state. So these sites are hundreds of miles apart. And when we were trying to identify how do we support these all, we decided to go to our farmer base because the farms that we work with are in all of these communities selling through the farmers markets where we have our double SNAP dollars program. And they were really the voices that were able to bring in our COVID support services to their markets. So just that being said, we supported over 150 small farms in over 13 Montana counties in the last year through the double SNAP dollars program. What that looks like, and on here, 6,600 program participants, with 96% in our annual evaluation reporting that they eat more fruits and vegetables. And that also is increasing variety of fruits and vegetables as well. So that is a really high number, I think, in our evaluation for showing program success. And annually, we like to say that we're pushing $1 million. I know that there are a lot larger programs out there, and we'll hear from one later that's in the millions just annually through one farmer's market, but that's through our whole state. And in Montana, it's kind of, again, a special circumstance because a lot of the communities that we work with are in really remote areas, really rural areas, where they might not even have access to internet. And on top of that, might not even have access to cell phone services. That LTE bandwidth doesn't even exist out here in a lot of the communities. So we have really interesting and intricate ways to implement our programs. I just want to cover our program model really quick to showcase how our partnerships enabled us to actually support markets through our COVID response. And our program operates through a hub and spoke model where our organization acts as the hub of money, planning, and coordination for our Double SNAP program. But then we partner with other regional organizations that have better ties to their local community, to their producers, and to their SNAP users to actually get the word out about our program. And so we have regional coordinators throughout the state. We have several seats that are still open. But the reason that we do that is the regional coordinators, we then pass some of our GusNIP grants through to them as a lump sum, and then they coordinate with their local partners. This helps us work with local knowledge so that we can actually implement our program with real facts, and we have people on the ground in the community where we're doing this. And it also helps with those existing relationships with local growers. On one side, it helps with our Farm Direct program so that we can actually get SNAP farmers authorized and part of our program. But again, it helps with this producer-driven growth model where we actually use farmers as program ambassadors in the community to talk about our program. And the reason this is important is because those agencies and organizations that we partner with were able to then get on board with our COVID strategy so that we were able to cover our whole state and our whole network rather than just the actual community that my organization works in Western Montana. And what happened is when the pandemic first hit, everyone was rapidly trying to come up with ways to deem their markets essential and come up with these kind of action plans so that markets could stay open. And while CFAC was helping with that, there was one organization in particular that I'd like to spotlight that I'm so thankful for. It's the Western Montana Growers Cooperative, and they're in Missoula. They're a food hub that aggregates and distributes food across our state. And we're lucky to have them as program partners because they have a really large SNAP CSA program. So we've been working with them for the past 5 years. And what they were saying is that they distribute to all of these different communities where we have the farmers markets participating in our program. And while they aren't distributing to those farmers markets, we did identify that we could create these connection points between the growers co-op and the farmers and markets in those communities so that we could actually distribute some materials through the co-op to these different farmers markets in their communities. And they were able to do a lot of modifications. This picture that you see here is actually from a Wallace Center study. They were one of the farm to family food box providers in the nation, and we're the only one in the state of Montana. And so we were able to partner with that program, which was a COVID response in and of itself, where they were distributing these food boxes to remote, rural, and native and tribal communities in the state. So we were able to put marketing materials in there, different handouts and flyers about the program, and we started hitting all of these new people that may not have known previously about SNAP matching programs in their communities. And I'll go to this next slide. So what we ended up doing with the funds through the rapid response, there was a local distillery they were also able to pivot really quickly and started producing bulk hand sanitizer. We ended up purchasing, through this grant, we purchased 380 gallons, and with a match from that growers co-op, I think we purchased around 500 or 600 gallons of this bulk hand sanitizer. And kind of interestingly, what this picture is showing here is kind of the packet or kind of box that we were sending to all of our different markets and GusNIP incentive providers, where it was hand sanitizer. We were providing face protection before we kind of realized, and the CDC came out with information that bandanas weren't the best thing. We did purchase thousands of bandanas and distributed them across the state, which I still think was providing some kind of a line of defense. And then after we got news that bandanas weren't necessarily the best option, we did purchase real masks and sent those out to the markets as well. And so we had these kind of bulk jugs with these hand pumps for entrances, exits, the market management booth, and for individual vendor stalls. And then we also distributed pocket-sized hand sanitizers for all the market managers and volunteers that they were working with. And basically, we got this knowledge and we knew that this is what they wanted, because in the beginning of the pandemic, we did distribute a survey to all of our partners. And basically they responded with, we can't find access to hand sanitizer in the amount that we need. If we could buy it in bulk, we could, but we can't afford it. So can we do it collectively? And that survey is really what helped ground kind of our ideas and what to do. And so we set up an order form, and I'm sure that a lot of other programs do this too, but in the spring, we kind of have an order form for tokens, marketing materials, and other supplies. So we just included the sanitizer and PPE materials in that order form. So all of our markets were able to just order directly through the Google form that we set up and tell us how much sanitizer and other PPE that they needed. Really interesting process after that. So the number one challenge was actually finding the plastics. So those like jugs that you see in the little hand pumps, as boring as it is, it took me hours and hours and hours to actually find accounts where we could buy these bulk, because we bought hundreds and thousands of all of these plastic containers. And then it was actually me and some of my friends and volunteers that went in and actually reportioned all of that bulk sanitizer into these jugs. So I spent hours just with my hands deep in hand sanitizer, and I'm very familiar with it now. One challenge to the program was that we didn't actually get the sanitizer product before distributing. And as others may have found out, hand sanitizer that was produced in response for COVID by distilleries basically smells like vodka or gin or these other alcohols. And so it wasn't necessarily the best fit for everyone, because there are people that are recovering and have different sensitivities to alcohol smells. And so we did, in the end up sending out some lavender tinctures to include in it, which I'm not sure if that helped or not, but we tried.
Hey, Ian, you're at time.
Thank you, Rachel. I can go really quick and just get to the impact. Thank you so much. We did do a specific marketing campaign too. We had sanitizer and COVID-related marketing materials just to support on that side. And overall, throughout the program, we supported 18 markets, 2 CSAs, a grocery store, 37 individual farms, and then our tribal partners at the All Nations Health Center here. And we had 2,200 double SNAP customers go through our markets that year. So thank you so much for your time. That's the one that we did in Montana, and I am so excited to introduce the next speaker. She comes from California, so is another West Coast partner, and that's Abby Winship Oyas, and she is the assistant manager of the Heart of the City Farmers Market in San Francisco. She supervises food access programs at this twice weekly nonprofit farmers market that distributes over $1.5 million annually in food assistance. And this connects low-income San Franciscans with fresh, local produce from small California growers. Abby has been with Heart of the City Farmers Market as a customer since 2010 and on staff since 2015. She enjoys reading, hiking, and surprise, spreadsheets.
Oh, Abby, you're muted.
I'm going to unmute myself first. Okay. Thank you, Ian. All right. I think I did that. And I'm going to go ahead and share my screen. Ooh. Let's see that one. This one. Okay. And present this. Hello, everyone. First and foremost, I want to thank the Nutrition Incentive Hub for the invitation to present today and for their support of Heart of the City Farmers Market with their mini grant for rapid response to the COVID-19 crisis, and as well as our recently awarded funding for capacity building and technology innovation. This funding helped keep us stable in the early months of the pandemic, and now we're able to implement some needed changes at our market as a result of technology innovation. Heart of the City Farmers Market, as Ian mentioned, is an independent farmer-operated nonprofit farmers market serving San Francisco since 1981. We'll be celebrating our 40th anniversary this June. We're open every Wednesday and Sunday year-round, rain or shine, and today's a very rain or shine day, just can't make up its mind here. And we're also open on most holidays. We're a critical food resource for the community that we serve, so we rarely close our market. People need the food that's available here, as well as the farmers need an outlet to sell their products. Our mission as a nonprofit organization is to support and sustain small and medium-sized growers and make fresh food accessible for low-income customers who struggle to afford healthy food in a city with the highest cost of living in the nation. We distribute $1.5 million annually in food assistance, and that's largely in CalFresh SNAP benefits and market match nutrition incentives. So it brings us all here together today. And so that I'm clear about what our programs are, what they're called. SNAP in California is called CalFresh. And at Heart of the City Farmers Market, we're just one location in San Francisco Civic Center. Customers purchase tokens and vouchers with their CalFresh EBT card at our market information tent. And then they spend those tokens and vouchers directly at the farmer stands. Market Match, and shout out, I saw a lot of my Market Match partners are attending the call. Hello, everyone. Market Match is California's healthy food incentive program. At our farmers market, it matches customers' CalFresh benefits with additional incentive tokens and vouchers to purchase fruits and vegetables specifically, not any SNAP eligible item. And that's run by the Ecology Center in Berkeley, California. So CalFresh and Market Match are not the only food access programs that we're a part of here at our market, but they're the most relevant to nutrition incentives and by far our largest program. So for this short presentation, I'm going to focus on those two. We are really proud of the work that we do to put out so much money into the community to so many different people. But the fact of the matter is that we're in a community where there's just a tremendous demand for nutrition incentives. We're adjacent to San Francisco's Tenderloin neighborhood, where it's extremely low income. So that means that a lot of CalFresh customers just live close by to the market, and there's no full service supermarket within walking distance of the neighborhood. So we are the market for produce for many customers to get their produce, fish, and other weekly staples. Tenderloin is also home to a very ethnically diverse population. So the market is also a venue to purchase culturally appropriate foods that might not be available in traditional or other nearby markets. The COVID-19 pandemic has only exacerbated the community's food insecurity, as reductions to public transit and the challenges of social distancing on crowded streets have left many residents stranded without access to healthy food. Additionally, as nearby offices and schools and businesses and theaters have closed, we've lost the office workers that bring in a higher average spending and support more of our niche farmers and small food businesses. So that income is lost, and we've become isolated from the rest of San Francisco, whereas Safe Sleeping Site has opened on another side of our market, and that's taken away our parking. And a Safe Sleeping Village is the city of San Francisco, for the first time ever, sanctioned a space where they allowed people to set up their tents and sleep overnight, and the city is providing sanitation, bathrooms and showers and food for people who are unhoused. And we think that it was a very necessary response to that need early on, but they've been slow to offer a permanent housing solution for these people, and there's no real indication when, if ever, we'll get at least part of our parking back. And I will get back to our food access programs now, and this picture is of our market last September, when we also had terrible air quality. So this is all going on at our market right now. And as if that weren't enough, our CalFresh, the number of CalFresh customers coming to our market also significantly increased with the start of the pandemic. And we were able to react to everything in stride. It's just apparently what we do. And I know better than to think that it's ever going to stop. It's always going to be something else. But in the previous year, 2019, we had gone through a similar growth spurt. So we had some knowledge about how to pivot to big changes. And that was as a result of in California, it's called the SSI cash out reversal, where seniors and people with disabilities who are receiving SSI benefits became eligible for CalFresh food stamps for the first time. They're one of the last states to do it that way. So from May 2019 to June 2019, our SNAP EBT program increased by 78%. And we're like, whoa. And so it was very overwhelming for us. A lot of thinking on our feet, like collecting our tokens and getting them back out, ordering more tokens, and just making sure that we were meeting the demand in the community. And we did that. And just as I was like, all right, I think we've got this figured out. It's like, well, have you tried a pandemic? And yes, I guess we'll try a pandemic and see. So we had similar growth. In 2019, we went up by 375,000 over 2018. We did that again in 2020. Oops, how am I getting to my next slide? Here we are. So in 2020, I mentioned we did that again. We exceeded our food relief distributed in 2019. We exceeded that by 363,810. And in the past 12 months alone, so this chart shows our growth over the past 10 plus years, but the past 12 months, so basically the whole pandemic from March of last year through February of this year, we distributed $952,902. That was only in SNAP EBT. Additionally, we put out $655,743 in market match incentives for fruits and vegetables. So we're the $1.5 million is for real. We expect that to continue to increase.
Hey, Abby, one more minute. You're almost at time.
Thanks for the, all right.
We'll make it work.
When we pivoted in 2020, we were not able to do the demand, like we were at our limit with what we could do with tokens. And on top of that, our token production factory shut down due to the pandemic and didn't have a clear date when they would reopen. So we introduced a voucher system, and good things about the voucher system that is cheaper than tokens. We were able to do away with a purchase limit where we would tell customers, like, we can only give you so many tokens. You've got to spend what you've got. And if you spend it all, you can come back and get more. We're able to implement expiration dates. And we initially started with just numbers that we had to manually enter when we're tracking our vouchers on the back end. And then we switched to barcodes. And so that was one thing. And then we learned, well, let's use we can use a handheld scanner for those. Until ultimately, thank you Nutrition Incentive Hub, we now have a Fujitsu desktop scanner that it makes having a voucher program viable for us. And then in order to do that, we had to switch from initially tracking by hand every EBT transaction. We're now integrated that with our Square point of sale system that we'd already been using for our credit card sales, as well as, of course, spreadsheet formulas, tracking everything on the back end, making sure we have everything accounted for. So with those changes in place, we were able to launch on January our bulk purchasing program. And now, rather than having a $5 daily match, we changed it to a $30 monthly match. This is a result because we were serving so many customers. We're coming every day to get $5 at a time, and now we're doing $30 per month. So people only have to come once a month, wait in line once a month, and get their benefits and incentives for the month. And just as this has been such a relief for us because we were seeing before SSI cash out, before the pandemic, we were seeing around a little over 500 transactions per day with SSI, and went up to almost 800 transactions per day. In 2020, it was between 11 and 1200 for the year, but during last fall, it was over 1400 transactions per day, and it was just very rough on our tent support staff. But with the bulk purchasing program, we've now brought that number back down to a more reasonable 600 transactions per day. And as a result, with the shorter lines, our staff team is relaxed a little bit, and we're also able to serve more customers, more different households. We do expect that number to grow since we served 11,000 SNAP households in the past 12 months. I want to say thank you to our essential workers. I appreciate our staff so much, and the Nutrition Incentive Hub for helping us purchase the PPE to keep them safe while working on the front lines. And I will end there to say thank you and take questions at the end. And I will now introduce Gabby, Gabby Seltzer is the program manager at DC Central Kitchen's Healthy Corners program. She manages partnerships with small retailers, government and nonprofit partners, and industry groups to increase access to healthy foods at corner stores in Washington, DC. Her role also involves overseeing marketing and program evaluation and spearheading projects such as SNAP matching, WIC authorization, and local sourcing. Gabby's been with the DC Central Kitchen since 2018 and has a background in food business and sustainability.
Thanks, Abby, and thank you everybody for having me here. I'm gonna try to go fast because I know I'm the last speaker in the last session of a day. So let me just share my screen and we'll just get started real quick. Great, so I'm going to talk about our COVID adaptations from the corner store program lens. But just for some context, the DC Central Kitchen is a social enterprise nonprofit food hub in DC, and we have several programs, of which Healthy Corners is the most recent, formed in 2011. And we provide fresh produce and technical assistance and various other supports and resources to corner stores in DC. And we also received CINI funding in 2018 and GusNIP funding in 2020 for SNAP matching at a subset of our corner stores. And how do I change this? Let's see. Okay. Grocery access in DC, I just wanted to give an overview for folks who haven't been here. DC is obviously the capital and on the news all the time, but people don't really hear about the enormous wealth and health disparities in our city. So this map you can see is broken down by wards, which are the neighborhoods in DC. And as you can see, the purple dots are full service grocery stores, and they're in much higher concentrations in certain parts of the city than others. East of the Anacostia River is Ward 7 and 8, and those are disproportionately affected by these gaps in groceries and in every other resource as well. So you can see there are only 3 full-service grocery stores serving over 150,000 residents, which is just absolutely terrible. And of course, in COVID, even more of a health hazard for everybody. If you can, imagine going to a grocery store that serves that many people. The crowded conditions are just really unsafe. And so the need for more small stores, there's always been a need for healthy produce at the smaller stores in between these larger ones, but in COVID, that's exacerbated even more. So this is the Healthy Corners same map, but with our Healthy Corners stores. We have over 50 stores around DC, and over half of them are concentrated in Ward 7 and 8. But they're sprinkled around based on grocery access, both how close they are to a full service grocery store and also availability, quality, price of the produce that is available in that neighborhood. And we are the delivery service for fresh produce and some healthy snacks to those stores, which is filling a supply chain gap in DC. It's really easy for a store to figure out where and how to stock unhealthy items, but it's really difficult if a store wants to stock fresh produce to figure out how to get it. So we're providing refrigerators, shelving, the produce delivery, and a lot of one-on-one support and marketing to make that happen. And corner stores are a great spot for us to reach folks who don't already have a habit of buying fresh produce because they're visited so frequently. And we've seen in our customer surveys that more than 60% of our shoppers visit their store every day, sometimes even more than that. And during COVID, of course, people are making less trips to the store, but they're still able to get there in walking distance and get just what they need and get out quickly. So yes. And this is just some of our products. We have a value added line, which is the cut fruit, and then whole fruits and vegetables too. And then we, as I mentioned, we receive GusNIP funding for SNAP matching at stores, currently paper coupons, but that will be digital soon. And the model is that folks can spend $5 using SNAP at the store and include at least one fresh produce item in their purchase, and then earn one of these coupons for fresh fruits and vegetables. That's been hugely impactful in our program. We have this at a subset of our stores, and those stores had an increase in sales by 300% when they first got this program. More than 30 new produce varieties stocked per store on average, and 75% of customers say that they eat more fruits and vegetables because of this program. And okay, yeah, I'll move on, moving quick. So COVID-19 had a major impact on our stores, and I wanted to share some data from a survey that we took in April 2020, so just soon after the pandemic had hit. And it's really interesting because different stores had vastly different experiences. I would say some stores, some things were the same. Everybody struggled with staffing, employees being afraid to come to work or having to stay home because their kids' school was canceled, and having to bring in new people and train them while keeping distance, PPE, like those things were all hard for everyone. But based on where the store was located and what types of relationships they built with their customers, there were actually major differences. So we've seen like the stores that had, you can see in these graphs, more customers than normal and more demand than usual, tended to be the stores that were in residential neighborhoods and who had really high level of trust built with their customers, so that their customers felt safe coming to their store instead of a grocery store. And those are also the stores that were really good at pivoting the moment this hit, and just working really hard to make sure they were stocked up and staffed up to meet the demand of their neighbors. The stores that have less customers than usual and less demand than usual tended to be the stores that were located near schools or near workplaces that were closed, because a large percentage of their customer base wasn't shopping there anymore, or the stores who just kind of had trouble pivoting right at the beginning or didn't have those trusting relationships with their customers. And then the impact on customers as well. We all know this. It was scarier to go out to stores, and there was increased reliance on SNAP. So I didn't pull the specific numbers, but we did have a lot more dollars redeemed to stores through our coupon program after COVID hit. So this is really the bulk of the presentation, which is the program Adaptation and what we were able to do with our capacity building grant, thanks to the Nutrition Incentive Hub. So the first thing we did was pivot to an online ordering form for our stores, which was a huge shift in our model. Usually stores we would have delivery drivers who helped the store figure out what they wanted at the point of delivery, which was always kind of a pain point for our program. And COVID actually gave us the opportunity to move to an online ordering form, which we never thought would be possible given the low tech literacy of our stores. So a large part of our capacity building grant was in staffing to support those stores and making a transition to using an online form. So we had different staff members from parts of the organization kind of redeployed towards our department to spend time on the phone with stores, make flyers, explaining how to access the form and how to place the order, helping them actually like take more ownership over what they buy and what sells and what doesn't in their store. We started using a text messaging platform to remind stores to place orders. So we kind of like have different subgroups of stores that receive text messages on different days to remind them and send them the link. We have a phone order option. So somebody who's always on the phone with stores, making sure they get their order in. If they don't know how to use the online form themselves, this person will place the online order for them. And then we also started a repeat order option where folks can have like a designated delivery day and a base level of products they get every week, and then get a call the day before to add any extra items. So what initially started off as just like scrappily pulling together people to help make this work ended up being a whole new position on the team that's been increasing our sales steadily since COVID started. We were also able to reduce the prices of our product. This is something that was possible because we are a large and well-known nonprofit in the DC area, and we got a lot of philanthropic donations at the beginning of COVID. So that was able to go towards reducing our prices for the stores and then also for their customers. So the stores have the same markup that they're allowed to charge customers, but we reduced the price for them so that savings would be passed along. And then we did low contact delivery. So instead of stocking their refrigerators ourselves and making it look all nice, we drop off a box, and that's a little unfortunate. We wish we could spend more time in the store. But again, it has shifted some of that responsibility onto the store. And I think that's a good thing in terms of long-term sustainability of our program. And then the app for our shoppers, this was something that was kind of already in the works before COVID, but then we were able to invest a lot more time and energy into making it work well because of the need. So this is an app that was built by students at Berkeley University, and they are software developer students that have a pro bono program called Blueprint that I would highly recommend. We're all very impressed with what they built for us. And this app allows customers to see what they can like favorite a store and then receive a text message when that store has received a delivery. They can see what products were delivered in the last 7 days, and they can see a map of stores to see like what's closest to them, what benefits they accept, etc. And
Gabby,
we're gonna
get, no, it's okay. The room is going to close in 1 minute. So if you don't mind, I need to share some gratitudes before we get cut off from the internet. First of all, gratitude for you for squeezing in at the end. Thank you all for making this all work. Thank you to the 3 presenters that we saw today. The work they've done is absolutely incredible throughout this pandemic. Gratitude towards USDA NIFA for providing the funding to the GusNIP NTAE to make these grants possible for Fair Food Network to distribute these grants to programs like the 3 that you saw here. Deep, deep gratitude for all of you and the programs that you keep operating despite these absolutely trying times. This work would be impossible to do without all of your dedication throughout all of this. So just, if you have any questions for these presenters, sorry I had to cut you off, Gabby, please, you can email me at ta@nutritionincentivehub.org, and I'll connect you to Ian, Abby, or Gabby, or you are welcome to reach out to them directly. Thank you all for being here. And please come to the mocktail hour that will be starting shortly.